All right, we are back. We've had a crazy technical problem today, but we're going to give Robert, he's such a good sport, we're going to give him his standalone show. This is your own show, Robert. We're going to just you and I for a few minutes. Important topic. Let's review again just the basics. Everything seems perfectly good now. We're working very well technically. Briefly.
And look how good Robert looks.
I know. Our transmission is much improved.
You have great skin.
So the issue, Robert, is that people got weird during COVID and started making state law specific to HIV, and it sounds like what was really at issue was knowingly exposing somebody to the possibility of transmitting a fatal illness. At that time, a fatal illness, now a chronic illness. What needs to be done? Do we have to go state by state? Does there need to be federal legislation? How do we deal with some of again, it's disconnected from reality, as you were pointing out. Most people with HIV that live long periods of time have essentially undetectable viral load, therefore they can't transmit it. So why are they being subjected to all these extraordinary, exclusive laws to HIV?
That is a great question. Just like COVID happened, AIDS happened back in the late 80s and 90s, but we didn't create laws around COVID, and simply because everyone contracted COVID, no matter where you were. The possibilities were endless in terms of that, unless you took proper precautions. I have many reasons why these laws still exist. One, of course, is just misinformation. But two, what it's associated with. Historically, it's been associated with gay people or sex workers or people who are of identities that we or some people don't choose to agree with. But people need to understand that HIV impacts everybody. There are all sorts of people that are living with HIV in the U.S. and around the world. And what we need to do is educate ourselves about that. That is important, and understand what is there available for us to, one, to prevent us from contracting HIV, and two, for those of us that are living with HIV and aging with HIV, to have access to the proper medical treatments and medicines that are very effective. I'm a person living with HIV for 22 years, and I've not had any complications with my HIV status, except the fact of being criminalized because of my health status. And that is something that I've had to deal with and navigate through. And through the advocacy, I've been able to join others in this fight to bring awareness about HIV criminalization, who it impacts and how. And we have begun that work to go from state to state, because these are state laws. And one thing I should point out is that these laws do not look at the fact of whether a person's in care or in treatment. They don't look at whether a person is undetectable, meaning that they can not transmit the virus to another person. None of these things are taken into consideration. It's just the simple fact that if you are living with HIV and you know it, and you are accused of exposing someone to HIV, and not disclosing now, sharing your status with them, then you can be criminally liable. And that is problematic. And that is very reckless.
Should it be different? Should it be different than other sexually transmitted diseases? Because there are similar laws for essentially all other sexually transmitted diseases.
Well, there's very few states that have what we call communicable laws for disease that are communicable. And HIV seems to be the only one that's isolated compared to how the other viruses
for criminal
are. Yes, absolutely.
For criminal.
HIV is the only one.
For civil, though, again, I'm not an expert in this area, but I think there's civil liability, right?
Well, one could bring a civil suit if they would like to. I think in most of those cases, people are either seeking some sort of monetary gain, right? But most of these laws are enshrined in the criminal code, and in some instances in public health. But this is a public health issue, and it's also creating a crisis around our civil rights. And if you want to go globally with it, our human rights. And so by criminalizing people living with HIV, they don't always get a fair shake in the justice system. I myself have had to go to court based on the accusation, and I had to plead because I didn't want to face many years in prison. But that is a common practice for people who are facing this type of situation. And many people who are in the Black community and even in the white community and other people, men and women that are impacted, not everyone has money to afford an attorney. And most people in the public eye, you're looked at as a criminal anyway. You're looked at as guilty simply because you're HIV positive. But no one really knows your story. They don't really know the impact that as to how you might have come across contracting HIV, or even what that situation is. In many of these cases, HIV is not transmitted. But we never know that because we only know is that this person's living with HIV. They're accused of exposing someone. And if you know anything about this person's situation, call the police. That is as far as the public's information finding out.
It's getting confusing for me. It's getting confusing for me because it's not been my experience that people living with HIV I actually did a show called I'm Positive where we chronicled the lives of people with this condition. And I've not experienced. I've seen ignorance, but I've not seen discrimination per se. Though I'm sure it happens. But I'm getting a little bit confused. So if somebody knows their status, their HIV status, and they have contact with another person without discussing it with them, even though you may be at a zero viral load, and for sure you're at a zero viral load, you're obliged in some states to share your HIV status with the partner. Is that it? Or you violated a law? Is that accurate?
You are considered to violate a law if you don't disclose your status to someone.
Okay, so it's sort of like an assault or something. Okay, got it.
In some instances, what do we do? Aggravated assault or considered a sex crime.
Okay. But what do we do with, so I'm dealing with this mostly with drug addicts with HIV who know they have HIV, who knowingly share needles with other people, knowingly have sex with other people, don't take their antivirals the way they're supposed to, and really would have no way of, because they're in their disease state, they have no way of knowing what their viral load is. What do we do with that person? Does that person, did that person do something wrong, or should there be laws against that?
Well, I do believe we should treat all like harms alike. If someone is in a drug-induced state of mind, and I will add that some people do drugs for harm reduction in order for ways of coping. That is a fact. Just like the criminalization of people is the fact. That's why I'm on here, because HIV criminalization laws do exist across this country and even around the world. If it didn't, I wouldn't be talking about it. I wish I didn't have to talk about it, but it does happen. But to your question, that person needs support. They need as much support as they could possibly get. If they are, in fact, taking drugs for whatever reason, again, harm reduction could be one of those reasons. That doesn't mean they need to be criminalized. They need support because life is hard. Life is hard in this country, and I know it as a Black man, a gay man growing up in the South, unaware that he was vulnerable to HIV because no one talked to me about HIV. If you look at the sexual health determinants of health, looking at your education, the environment in which people live in, their access to health care, whether they have money or not to be able to afford insurance, to be able to get tested or see a doctor, some of these things were not available to me as a Black person living with HIV, as a Black person growing up in the South. And that should say that it's almost like saying that everybody's living equally and we're not. And I'm just letting you know that there are communities of people, particularly Black and brown communities, that are suffering at the hands of the justice system simply because of their identity and simply because of their health status. If we want people to share their status, then we need to make it legally safe for them to do that. Although it's required, it is not legally safe to do it because you run the risk of being in prison with a felony and in some instances being on the sex offense registry, which makes your life even harder on top of the daily struggle that you have to live to just be productive and maintain your livelihood. And all we're asking for, and I think most people in this country are asking for a better quality of life. Do not take our healthcare away. Do not defund the programs and things that we need so that we can stay healthy and live a meaningful life and be productive. Most people living with HIV need support. We want support. We want to be able to share our status with people. But the world, the society in which we live in, especially in this country, the compassion is gone. There is no compassion today. The greatest manifestation of stigma is enshrined in the law, and those laws are still here today. But luckily, through our advocacy, we've been able to get some of those things changed. We have at least 5 states that have repealed their laws, and we have other states that
how does that work? How do you do that? How do you do that? Do you appeal to the legislature? Do you appeal to individual members of the legislature and try to get bills passed? How have you been able to do that?
Absolutely. Well, one, you form a coalition together, people of like-minded who stand behind this issue. And we've been able to get coalitions established since 2012 in this work of HIV decriminalization. We actually just had our 6th installment of HIV is Not a Crime Training Academy. And through that academy, we've been able to bring people living with HIV from across the country, including our allies, people who work in public health, lawyers, academics, and just the broader HIV community and LGBT community as well. We come together and we figure out how laws are implemented, how they're enacted in various states across the country. And we figure out a strategy as to finding a legislative champion who believes in what we believe and recognize and supports science and the facts around HIV and HIV science and recognize the injustice of HIV criminalization. And through that work, we work hand in hand through the legislative advocacy as well as educating people on the ground. And we all come together and look at this. And so, yes, we do find a legislative champion who would champion our cause. And through their influence and the process that goes on in the legislature, we are there to make sure to advocate, to testify, bringing in personal stories of people who've been impacted, to help people really see the human side of this issue, because that's what's missing. People are learning about HIV criminalization through the media, through law enforcement, who talks about the people, but rarely do you ever hear from the person who's been impacted sharing. And so that is very important in this work. And I can't stress the science, the advancements in science. It's real. We have data to back it up from the Williams Institute. There's various state reports that show how HIV is enforced in various states. And so we've been very fortunate since 2012, since I've been involved in this work, to bring awareness and also to change laws. The governor just signed a law in Maryland. We had a law change in North Dakota, as well as New Jersey and Illinois. And Texas, I think they repealed their law back in 1994, if I'm not mistaken. And so we know that this is possible, and that has been done by both sides, both Democrats and Republicans. And so it's,
I'm sure
there's hope that people do really see this for what it really is and are really trying to make a change in the world.
Thank you so much for joining us today and for sharing this journey that you're on. Tell us where you want people to go.
I want people to follow the Elizabeth Taylor AIDS Foundation. Go to their website. You can find a lot of stories from people who've been impacted. I want people to follow the partners in this HIV is Not a Crime initiative, the Health Not Prisons Collective, which is the Zero Project, Positive Women's Network, Transgender Law Center, the U.S. People Living with HIV Caucus, as well as the Equality Federation, as well as the Williams Institute. So there's places for people to go if you're the professional, the policy person, or even if you're the community person. There's lots of information out there today. And you can always reach out to me. You can find me on social media if you have any questions. I'm happy to talk one-on-one or to groups. And I would ask for people to support us in this work by talking about this issue. As I said earlier, you care about this issue, HIV criminalization, you just don't know it yet. And I hope that I've at least given you some insights as to why this should be important to you.
Appreciate it. Go to Suttle Points. That's where you can follow him on X. And we appreciate you being here and rolling with all of our technical problems, Robert. Appreciate it. Thank you so much.
Thank you so much.
You got it. And coming up for us,
Drew,
yes.
Somebody on Rumble, or Caleb on Rumble, said that sometimes you sit so still, he thinks that the camera's frozen.
I had to keep checking.
I mean, yeah, because you're
Let
Caleb.
there be light said, poke him with a stick.
Hey, somebody named Caleb said that. He's on the other side of this camera. So, okay, what's coming up for us? Let's go over the upcoming guests, if you don't mind. There we go. Tomorrow, Anuska de Georgiou. I will have to find out how to pronounce her name. Emily Hagan coming in to talk a little Epstein. Alex Stein, noon on Friday, special show. The rest of it. DC Drano, I think, is on the 11th, and I can't see anything else because we...
Dr. Vivek
Menike is coming in. Menike.
Say that 3 times fast.
I can't see anything else because the cameras, and we had to move the camera.
Salty Cracker.
Yeah, our camera was out too.
Salty Cracker coming back. Hallelujah. Get him back, rolled up, get him rolling here.
Hey, Caleb, how do you like the lower camera for Drew? Because it's a different shot. It's not.
I like it because it works.
Okay, yeah, exactly.
Well, yeah, we only have 4 cameras here. We can figure it out, but I don't know what. There's a ghost in here.
Well, I just like the fact that everything's working again now. So we went every once in a while. We have to go through this little exercise. We have to check all of our technical standings.
Well, there's more people watching now, so maybe we should do another show while we're here.
Let me remind everybody that
Everybody's loading in.
That Free-Shred MD stuff again. I am big on longevity now, and I've got these 2 products I'm very excited about.
We don't have the affiliate link yet.
That's fine. Put up there, Caleb, what the website is they can go to. It's NR Boost, and that is the PQQ, which is a very important mitochondrial support system for your muscles, and nicotinamide riboside, which is the main, main way to address the issue of oxidative stress on cells. I believe that entropy reasserts it.
Okay, he's back.
Oh,
all right.
There you are.
The oxidative stress can be dealt with by raising NAD with NR, and fisetin and resveratrol with the Senosync is an important additive. What's that, Susan?
We need to reboot everybody's systems. It's like our previous sponsor, which we love. Same product. But when you say nicotinamide riboside and all that stuff, like it's an NR product, right? So that's...
We're not frozen. I thought we were frozen too. All right, look at that website. You'll see it all there. Check it out. We've got a long, lengthy bit of information for you to check out. We appreciate it. Is there anybody who wants to interact with anything?
I know there's more people watching now than there were.
Let me quickly. Is anybody asking
you
questions
missed the show,
there?
but you can go watch it again later. It comes in 2 parts today. So
the people are. Where are they now? Are they on the restream? Or are they
on Rumble?
Rumble. Okay, let me go over to the rants and see what you guys are. What are they talking about there?
I don't know. What do you guys want to talk about?
So I can't go to it because I'm not signed in or something.
It says the show is down again. But
there was an interesting comment that someone had left on Rumble that you might find interesting. I'm going to put it up on screen.
What was it?
So it's from Black Dingo, and he asked everyone. Here he says, "Everyone is freaking out about this, but how else do you prove definitively that the mRNA platform is inherently dangerous other than having a placebo trial?" Which is interesting. That's an interesting way of thinking, because how do we know that the whole platform itself, all mRNA, do we know that yet? Or is it just the COVID mRNA?
We don't know that.
Okay.
We don't know that. All we know is that all we really know, there's speculation about the lipid nanoparticle, and certainly Naomi Wolf is very hot on that, it being an issue because it accumulates various places. But a lot of things accumulate in various places and never have any really medically relevant influence on us. But the spike protein we know is pathogenic, and that's the part I object to. And in certain individuals, it's clear that using that mRNA platform creates uncontrolled production of the spike protein that persists. And we have major, major problems with that. And all the people, Johns Hopkins, somebody told me this morning, has a whole department dedicated to long COVID. The reality is you can't tell any longer what is long COVID and what is long vaccine, because everybody has had both. Everybody's had the vaccine, everybody's had long COVID, everybody's had COVID. And when people get long-term symptoms, they have to really work hard to sort these things out. Except to say, last week we talked to a doctor who had a cohort of patients who had never had COVID. He knew that because they had no nucleocapsid protein. They only had the excess spike and the coagulopathies associated with that. They're clotting, the endothelium is inflamed, and they were having lots of long-term problems. So and he had a lot of solutions. You can listen to that show from Thursday. It was kind of interesting. There's still people struggling with this. You can go to covidlonghaulers.com. They also are trying to work. There's no definitive systematic treatment, but there are a lot of good ideas out there. And most of it is around trying to dissolve the spike protein, trying to reduce the risk in the burden in the brain and the so-called non-classical monocytes, and deal with the coagulation issues that have resulted from it. All right, we're going to wrap up here. Caleb, anything else on your front?
I'm just very grateful that we have Starlink, because I was able to bond it together and get us back online right away.
We got to figure out what happened.
Is Starlink the reason things are working so well?
Yeah, that's why it's, well, on my side at least, that's why it's working and getting through any glitches. So we need to get Starlink and your internet connection on your side bonded together like mine, so
my
it automatically
internet
switches over.
connection's fine today. It wasn't my end. I think it was your end.
Here, but I'm so grateful for Starlink. Thank you for putting up all the satellites.
I have the Starlink set up here ready to go if we have to plug it in.
Yeah, we do. It's true. So we're going to have to run here. We thank you so much for being here. We'll be here tomorrow at 2:00. We will see you there.
Ta-ta.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.